Good morning, everybody. Thank you so much, Sawadee Cup. Thank you to Thailand for inviting all of us here and for that powerful speech from Don. I was very moved by that speech. And it's very important to me, the ethic of cannabis as well. And that's really what we're talking about. My name's Dr. John Tay. I'm the Medical Director of Plant Med Cannabis Clinics in Australia. I was one of the first prescribers of medical cannabis in Australia, and my clinic has been successful and moving on consistently since then. There's a term that we bandy around a lot today, and it's medical cannabis. But what is medical cannabis? So the first part of my talk today will be around the medicine of cannabis. And then the second part of my talk will actually gel very well with what Don was talking about and the modes of bringing cannabis into a country. And in Asia, this is all very new. In fact, around the world, this is all very new. Prohibition has been stopping the progress of this amazing medicine for many years. And slowly but surely, the gate has been pulled at every one of the dams. More than 50% of the world now is utilising cannabis, either recreationally or medically. And I'd like to thank Thailand for bringing culture to my life. I came here as a backpacker. I went to Khao San Road when I was 19, went to the islands and had a lovely time. I came back in a professional sense in 2018 and was privileged enough to be in the research by the Thai government about how they're going to implement this program. And I can see that a lot of the things we talked about on the stage and we talked about in roundtable meetings has come to fruition in Thailand very, very quickly. So in all of us, we have the endocannabinoid system. And 15 minutes is not enough to cover this or do it any sort of justice. This system has been in our bodies forever. The endocannabinoid system is present in all animals except insects and some smaller invertebrate animals forever. The cannabis plant has been on the planet with us for many millennia. And we've used it as medicine and as food. And it works in our bodies. The two main endocannabinoids which we create in our bodies, which we make in our bodies, are anandamide and 2-arachidonylglycerol. And anandamide is a Sanskrit word meaning bliss. And it stimulates that bliss in our bodies, and it stimulates our bodies into homeostasis, balance. And that's what I'm talking about today, is bringing that balance back. And I think that's what Don was getting at as well, bringing balance back into our businesses and the way we think about cannabis. This system is hard to define. It's not a system of tubes or nerves or wires in our body, but a diffuse system. In any part of our body that needs balance or regulation, we will express cannabis receptors to modify that change. This is on our nerves. This is on our skin cells. This is in our gut cells. This is on our white blood cells, our immune cells. Everywhere. Every system of the body is run by the endocannabinoid system. When that balance is needed, we express the receptors, and then we make our own cannabinoids from our cell membranes to stimulate those receptors. This induces the change. That's a broad, sweeping statement, but that's what the endocannabinoid system does. It makes micro adjustments consistently throughout the day, throughout our lives, from birth to death. If we treat our endocannabinoid system with care, with love and support, both nutritionally and via herbal medicines such as cannabis and various other herbs that other speakers have been talking about, curcumin is one of those, or turmeric, then we can bring that balance. We can make ourselves live longer and stronger and healthier and be able to help our friends and families more. Endocannabinoids are present from birth. They're in the mother's milk. And not only is immunity transferred, but endocannabinoids are transferred to the baby. Not only that, those transmissions of endocannabinoids bring down the oxytocin, the love hormone, the mother hormone that creates a child-mother bond. So from birth until death, this system leads us from an embryo till we have grey hair and pass on. The two main receptors, cannabis receptors in our bodies, are called CB1 and CB2. CB1 receptors are central. They're in the brain, the nervous system. They control pain, they control temperature regulation, they control thought and emotion. They control our higher centers and all the deeper centers of our brain. Cannabis 2 receptors are found more peripherally. They're associated with inflammation, an inflammatory response, immune response mainly. They're also found centrally in the brain in a cell called the microglia. And the job of that part of the brain is immune response and inflammatory response as well. This is a picture just outlining the areas of the body where we have a high concentration of cannabinoid receptors. You can see the brain, you can see the liver, you can see the reproductive organs. And all of the systems of our body are involved. All of them. None are left out. The brain is highly dense with cannabinoid receptors because of the many functions that need to be changed all the time. And we can see the centers where listed on this diagram here, which are more dense in cannabinoid receptors. So the cerebral cortex, our higher brain centers. The central centers, the hypothalamus, temperature regulation, water balance, the amygdala, emotional, the hippocampus, learning and memory, the brainstem associated with walking, balance. And that's why we have the idea that when we smoke cannabis, we become slightly less coordinated. It's because of the effect on those receptors in the brainstem. One amazing thing about cannabis as a medicine is it's very, very safe. It's impossible to overdose on cannabis. You can harm yourself for sure, and I'll get into that. But it's impossible to overdose to the point of respiratory depression and death. And that's because of an absence of cannabinoid receptors in this area of the brainstem, which is responsible for heart rate and breathing. So that was a super quick summary of the endocannabinoid system. I'm not going to go into today the complexities of treating with cannabis. But the endocannabinoid system is about balance and bringing that balance. When we use cannabis as a medicine, we're affecting this system, we're stimulating this system. THC will bind directly to this system. And there's been a very big focus on THC in this room. THC is the main cannabinoid. Yes, that's correct. It's the one found most plentifully. Yes, that's correct as well. And THC will bind, orthosterically is the word, like a lock and a key with our cannabis receptors and stimulate them wherever they are, may be. So if you've got a sore knee, they're going to lock in down there and help reduce inflammation. If you're having anxiety or sleep issues, they're going to attach to your brain when the cannabis is introduced and stimulate those areas. And it's through manipulation of this endocannabinoid system that we can create great personal health benefits. But I think when we introduce it into a country, and that's what we're talking about here today, is we can bring great public health benefits as well. This is a famous doctor, Dr. Ethan Russo. He invented So this is Dr. Ethan Russo. He's a famous American scientist and medical practitioner. He developed Sativex, one of the first pharmaceutically registered medical cannabis products. And in the course of his work, he discovered some trends, some traits in patients that he was treating. And he coined this endocannabinoid deficiency. It's not a disease, it's not a syndrome, but it's something that he noted. It's a list of ailments he noted when testing these people. They had lower than normal endocannabinoids circulating in their bodies. And this list of diseases is, if we look closely, I'm sorry about the size of the print, we're talking about inflammatory diseases. We're talking about inflammatory bowel diseases. We're talking about endometriosis. We're talking about neurological diseases that are associated with inflammation, such as migraine, Parkinson's disease, seizure disorders and epilepsy. And so we coined this term, and that's what I do as a doctor. And that's what I hope all the doctors in the room who are into cannabis are doing, is we're tuning up this endocannabinoid system. We're saying, right, let's take away those stressful things from your life. Let's add some nutrition and some supplementation, which is integral. And one of the integral components that we must put into our bodies to have effective use of cannabis as a medicine comes from the plant itself in the form of the seed oil, providing us with the omega-3, 6, and 9 fatty acids that we require to not only create our own cannabinoids, but to create our cannabinoid receptors, and for us to use those cannabinoids we put into our body effectively. So by using the oil of the seed, or fish oils, we can boost these levels. So really, this is what we're trying to treat, is the deficiency of cannabis in our community and in our body more directly. We used to eat cannabis, we used to use it as a medicine as early as the 1920s in Australia and 30s. You could buy cannabis as a medicine in pharmacies without a prescription. All that's changed over the last 150 years. And we stopped eating cannabis. We stopped ingesting cannabis. We stopped using cannabis. But our bodies didn't have time to forget cannabis. Our bodies were the same bodies which have grown up with cannabis. And this is why it's so important we introduce these plants and molecules into our lives correctly. So we all know that the two major molecules in cannabis are CBD and THC. There are over 144 other so far discovered cannabinoids. There's a whole host of flavonoids. There's over 400 so far isolated terpenes that can be found in the cannabis plant. And this is what gives cannabis its taste. It's what gives it its medical abilities and capabilities in healing. So it's important we not isolate these compounds out in my terms. I believe that cannabis should be a natural full spectrum medicine. In my clinical practice, I've found that isolated THC and isolated CBD are less effective, significantly less effective in treating and getting a result in patients. And I should have left that slide on, but we can treat many, many, many things with cannabis. Inflammatory disorders are definitely high on the list. Pain from all sorts is definitely high on the list. We can treat seizure disorders, epilepsy. We can treat neurological disorders such as multiple sclerosis and Parkinsonism. We can treat basic ailments such as insomnia. CBD is particularly effective in a full spectrum form at reducing anxiety, common throughout our whole world now, especially after the recent stressful times we've all been through. So I agree with Don, and I agree with all the people that have talked, that cannabis is really here to help us. And we're here to help it, and it will be reciprocated. That's the money part. I'm not going to talk about that today either. So we can take cannabis, as we know, commonly via inhalation, oils, sprays, many formats. But when we ingest cannabis, how we ingest it matters. If we smoke or inhale cannabis, we get a sudden spike in plasma THC and CBD levels, and that drops off quickly. If we orally ingest cannabis, we get a much smoother curve. We get a 6 to 8 hour window of more consistent dosing. And this is something which I utilize a lot in my practice. I see the oils and the oral formulations, whatever they may be, tablet, capsule, as the baseline of our treatment. And then I see the inhaled products as the icing on the cake. We can use the inhaled products for quicker relief, quicker action, but not the duration. So when we're formulating our products, we should think about the reason. If it's recreational, well, that's different. But when it's medical, what's the reason you're growing this plant? There's people in this room that I know that are specialized in CBD, and I think that's an honorable thing to do, and a good thing to do for this industry, because we've lost the balance on our plant. We've lost the balance in ourselves, causing disease, and we've lost the balance of ourselves as, well, a bit presumptuous, but as a race. We need to bring that balance back. And we can see that this is a list indicating the fatality rates, the mortality rates associated with various drugs. And it's tiny, but right up the top is heroin or opiates, you know. They're things which we dole out in our communities, and it's a really serious public health problem. And then it goes all the way down through alcohol, cigarettes, methamphetamine, cocaine, MDMA, codeine, and we keep going down tobacco, DMT, and then we get into things like Prozac, nitrous oxide, LSD, psilocybin. The rate of death from heroin is 1 in 6, meaning 6 times the dose rate will kill you. So we can see the relative rate down the bottom for deaths from cannabis is less than 1 in 20,000. So essentially, no risk of death. This is just safety statistics there. We'll skip through those. But how's cannabis changed in our time? It has changed. We have in our minds a nostalgic memory of the 60s and 70s, free love, hippies, smoking cannabis. But was that cannabis the same as it is now? And the answer is certainly not. Pre-prohibition cannabis, from 70s and well before the 70s, the actual THC content of the cannabis that got to the consumers, the cannabis that was consumed and tested, confiscated and tested, or taken and tested in those days, had a THC content of about 4% and a CBD content of about 1%. So that gives us a 1:4 ratio. 1 part CBD, 4 parts THC. And a very low THC percentage. Today, and in this conference, I've heard people talking about 37%, I think was the 36% THC. I've never even heard of that. I've never certainly seen that content THC cannabis. But it's very common to get 20, 25, 28% cannabis in our industry. So when we compare the cannabis of today to the 1970s and earlier cannabis, we can see that we've got THC levels of about 20 to 30% is fairly standard. But in fact, the CBD level has gone down in our cannabis from 0 to 0.5% on average. Of course, we've got our high CBD strains, which are great, and there's some great balanced strains as well. But selective breeding during Prohibition has essentially pulled all the CBD out of a plant and increased the THC, because that's what the consumer wanted in those periods of Prohibition. They wanted the THC effect. But the ratio has gone well out of CBD and THC, and I'll tell you why it's important in a second. The ratio of today's cannabis is about 100 is to 1 or less. THC is to CBD. So we've lost the balance of our cannabis. But what does that even mean? Here's some imagery of pre-prohibition cannabis, and we can see on the left our new, amazingly cared for, beautifully grown, protected cannabis of high THC content. So we're really looking I can see a correlation between the land races we're talking about having in Thailand, which are great and climatically suited, and our overseas or Dutch or Californian developed strains. So an important thing I want you all to understand is the importance of CBD. In my clinic, and we have over 6,000 patients we've gathered over the last 5 years since we started, probably more, I've lost count. But an important thing which we make sure that happens is that anyone taking THC has CBD included in their treatment program. CBD is the main anxiolytic component of cannabis. CBD is used to treat anxiety. We've taken all the CBD out of our cannabis, and we wonder why people are purchasing and consuming high-strength THC. We wonder why perhaps they get anxious sometimes. Not only anxiety. If we take THC with any regularity in high dose, we actually get changes in the hippocampal area of our brains, the deeper brain centers associated with memory and emotion. And in animal models, because we don't chop people's brains up these days, we can see the physical changes that occur in the cells of those structures that are akin or similar to the changes we'll see in schizophrenia, bipolar, manic depressive states, psychotic illness. So by giving people a lot of THC or introducing a lot of THC into a jurisdiction without a balancing amount of CBD, we're essentially doing that to a population, or the population that consumes cannabis. When we add THC in, or to that consumption, not only do we get an offsetting of that effect, where we don't see those physical changes in those parts of the brain, but we get a reversal. So if you have had those issues, CBD is acting as an antipsychotic to you. We can, instead of using olanzapine or haloperidol, very heavy medications, we can introduce CBD into a community. And that's why I really value the way that cannabis is being introduced into Thailand. I see there is a strong undercurrent of organic farming. I see a presence of CBD being pushed by as the agenda of the government or the king in this situation. And I think that's a good thing. I like the way that cannabis is being used to power an economy, to power change for the people. And although it's been brought in under the flag of medical, is it medical or is it recreational in this country at the moment? It's a bit of both. It's certainly a bit of both. And I see no problem with using that to help your population. And it's not hurting anyone. So I think Asia is an amazing opportunity. I'm half Asian. There's a lot of Asians. The Asian economy is often very agronomic, so they have got a strong farming background. They're often very herbal or herbal medicine based, and so they have that background as well. So in terms of public health, we can improve public health by correctly introducing cannabis into a community or a jurisdiction. And I think making CBD very prominent in that for a public health initiative is very important. And there's many ways which we can introduce cannabis into a jurisdiction. Not all of them good. I think if we introduce cannabis well and make it affordable for the majority of the population, we're going to see a reduction in these diseases of the West. The inflammatory diseases, high blood pressure or hypertension, heart disease, diabetes, bowel disease, cancers, anxiety. But we need to do it properly and correctly. And we want to look and think about what the jurisdiction requires. What does Thailand want out of cannabis? They want a healthy population. They want it to be cheap and affordable, and they want it to bring them money through travel revenue, medical tourism. But importantly, I think they want to bring about the health of the country. And that's a very admirable aim. When we introduce cannabis into jurisdictions, and this is a study from The Lancet, which is a very prestigious medical journal, we can see that in states and countries where cannabis is introduced medically or recreationally legalized, we see fewer road crashes associated with alcohol. We see less deaths from opioids. We see reductions in alcohol sales in jurisdiction of legalized cannabis, which is great from the public health perspective. Alcohol is the second biggest killer after cigarettes. We don't see an increase in the young taking cannabis. Not at all. People under 21 don't suddenly want to smoke pot just because it's introduced to a country, especially when it's medically introduced, because I think it loses its cool factor. If grandma or your auntie is using cannabis, it's not going to make your 12, 16-year-old daughter want to go and try that cannabis. They'll see it as a medicine. I see it as a medicine. And the line between recreational and medical is blurred. If you've got a bit of anxiety or you need some help with sleep and a little bit of cannabis helps you with that, that's medical to me. If you're just having it for fun, recreation, that could be medical too, stress relief. But there certainly is a large percentage of our populations that can deal with proper medical care. And cannabis is a proper medicine, which integrated correctly into a community can help people individually and on public health level. One of my passions is talking. One of my passions is educating doctors and nurses and pharmacists and ancillary services, governments, corporations, about how to use cannabis as a medicine. And it should be used properly, and it can be used properly easily with fairly basic training. I think bridging the gap between medical legalization and recreational legalization is a tricky one. I think if we can see from countries like Canada and the United States that rushing into a fully recreational market may not be the best thing to do. Being very mindful of your intention. Be very mindful of what's already in your country. What's the black market like in the jurisdiction that you're going to place your business or where you live? What's the black market presence of cannabis? What's the cost of that cannabis cost? If your medical cannabis is more expensive than the black market cost, well, there's not going to be uptake. If your medical cannabis is much cheaper, well, then there certainly will be uptake. If we overtax and over-legislate and make excess financial burdens on all the people in this room, and to the point where the black market is able to begin to undercut again, well, then we lose the balance once again. And we've certainly lost that balance in the States and Canada, where the black market and the illicit market has actually been picking up of late. So we need to find that balance. How do you do it? There's no roadmap. There's no direct way which I can say we should introduce medical cannabis and then 6 months later we should introduce recreational cannabis. And there are a lot of issues associated with cannabis introduction. In Australia, we are very heavily regulated. Cannabis is only available through a medical practitioner, though any medical practitioner in the country is theoretically allowed and able to prescribe. We have very strict compliance required with cannabis purity, cannabis consistency, lack of additives. So this is getting into the way which we regulate in Australia towards a GMP manufacture. And I'm not going to go deeply into GMP. There's someone doing that later on in the day, I see. But there's a certain set of countries, actually, which follow GMP. GMP is good manufacturing practice, and it's really a term used for the pharmaceutical industry. It really just basically means that the product you've written on the label is as it says it is. It's within a certain percentage of what it says it is in terms of active ingredient. There's no bacterial, there's no pesticide, there's no fertilizer, there's no fungal contamination of those products, and that they're safe for humans to consume. This is a pharmaceutical grade product. So what does your jurisdiction or company wish to do? Does it wish to expand and export a high quality product from a country such as this to the rest of the world? Then your product should be grown to be able to meet the GMP standards. And cannabis being a plant, it's a bit of a funny area as to where GMP stops and begins, because you can't really grow a GMP plant. But the way it is handled, stored, fed, and transported and tested is about the GMP compliance. So all it really means is have a high quality product. Have a high quality product, and then you'll be able to get it into these markets. I'm not a GMP expert, so I'll leave it there, but I think it's a really important concept to get through the heads of anyone coming into a medical cannabis industry. Because medical cannabis implies it's a medicine, it's for human consumption, and it must be safe. And that's what Don was talking about with moldy cannabis entering the country, which he's not happy about, and of course he shouldn't be. Because you can get fungal infections in the lungs which cause pneumonias and fatalities. So we have to ensure that our product is good. And that starts at the farmer and goes all the way through to the end user. Testing is really important. And we should, at all stages in the growth cycle, especially at packaging and transfer into medicine, we need to make sure that there are no impurities. And this is another reason for bringing cannabis into a jurisdiction well. We really don't want the black market or illicit aspect to maintain and thrive because there is no regulation. There is necessarily no ethic. Cannabis can be contaminated with many things. Cannabis takes up things from the ground, so it can take up ground contamination, takes up heavy metals. Often it's contaminated on purpose. It's not uncommon for unscrupulous illicit communities to lace cannabis and sell it into the population with narcotic drugs. Fentanyl is a big one. Fentanyl is a very, very strong synthetic opiate. And so a little spray on a bag of cannabis makes it a very strong indica. Similarly, in Australia, I know that not so savoury elements aren't afraid of putting a little amphetamine into their cannabis. And other things are just put in for weight that aren't good for our bodies. If we're going to take these things into our bodies, we need to make sure they're clean and we need to make sure they're balanced. So, this is an example of one of the certificates of analysis that I get with all of my products at PlantMed. We have a small dispensary that goes along with our prescribing, and we have a group of doctors, and we all have access to every product. We have access to the CBD and minor cannabinoid levels. We have access to microbial analysis, heavy metals, foreign matter, alpha toxin. Of course, THC and CBD percentages must be within I think it's 1 or 2% of what is stated on the label. So we know what's in the medicine. Dosing is so important for cannabis as well. So how do we dose in a public arena? That's a very good question in a public space. I think it has to be done through pricing and also probably through subsidies of the things that we want to promote. So we should probably subsidize CBD, for instance. We should probably make it very, 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 very cheap for people. And we should probably subsidize the farmers that want to grow it and the companies that want to invest. We should give them advantages to bring quality CBD products into the jurisdiction. We should probably tax THC a little heavier. If you're going to buy a 36% flower, you can buy it, no problem. But maybe we just add a little milk tax on. We need to incentivize people to make right choices for their health. We know that people don't do that on their own. We can just go to McDonald's and see that every day. And we need to make sure we have that balance. And this is just some imagery of the kind of level of pharmaceutical diligence that GMP involves. I think it's a really good idea to have your business structured in a way that can lead you easily into this path. And I know that there's a lot that goes into the designing of GMP facilities. So if you're extracting cannabis as a medicine and want to sell it to me in Australia, or you want to send it to Europe and sell it there, or any of the other nations that engage in GMP, which is most of Europe, South Africa, Australia, England, and America, then when we should be ready for this. And this is a big thing that's happening in Australia next month, or the month after. There'll be a new regulation coming in that says all products that are coming into Australia as medical cannabis, we don't have a recreational market, must be GMP certified. And that's going to bring a lot of disruption to our market because I know that at the moment they're not all GMP certified. And this is a great picture, I just put it in because it's beautiful. It's cannabis under the electron microscope. And we're looking at the trichomes and the hairs of the cannabis flower. And that's where the medicine is. It's not the green part. The green part's just the solar panel. The medicine's in those beautiful little crystals that cover every centimetre of the cannabis flower. So what's the take-home points from this conversation? Number one, we as humans have evolved with cannabis. Number two, because of that, we have an endocannabinoid system, and it plays an intrinsic role in achieving balance and homeostasis in our body for health. Cannabis used correctly can have great public health benefit. Cannabis is obviously very good economically. The method of legalization and introduction of cannabis into a jurisdiction is very important and should be personalised for that specific jurisdiction's requirements. And I think that's what Don and his amazing team are achieving in Thailand. The aim of the policy, which in this country is deigned by the King, is to bring CBD to the people that need it most, those people being the poor farmers who supply food not only to Thailand, but to the rest of the world. And now they can also provide medicine to their own selves, grow it in their own fields, to the country as medicine, and to the suppliers, if I'm getting the business model right, who want to come into this country and get a good API and make formulations to send to other countries. Very good idea. And we should take into thought what the skills of that country are. In Thailand, we have great agronomic skills. In Japan, we have great technological skills and great agronomic skills. In fact, throughout most of Asia, we've always been farmers. What industries already exist in that country? How can they be used to facilitate the correct implementation of cannabis into your jurisdiction? What's the ability of the population? What's the social perception of cannabis in your community? I saw a statistic earlier today that well over 50% of Thai people are actively interested and curious of cannabis. Yet in Australia, I know that percentage is probably more, well, not too far off. Like in the last polling that was done, it was about, I think, 50% of the population that voted for legalisation of cannabis for adult use. It didn't go through yet, but I'm sure it will in Australia soon. And I think when we move to that state, and this is the opposite problem in Thailand, how do you blend the medical use and the recreational use? How do you legislate it? How do you jurisdict it? But most of all, we have a need for balance. And I hope my talk has brought a little bit of balance into your thought process. And please come and chat to me at the round table. I am very passionate about what I do. I am very skilled at medical education, especially around cannabis medicine. I've got a lot of experience treating people clinically with cannabis and amazing results at that. So I welcome your contact. I too am an ally of you all. And if I have any skills in these areas which you could use, please contact me, come talk to me afterwards. And let's get the balance back in this plant. Let's get this plant to the world because it can bring the balance back. Thank you very much.